teleboard meeting. I hope that you've all been healthy and safe during this time, and this month and subsequent meetings, the public will be able to view these meetings real time on Facebook, with this being the first one. So with that introduction, I'd like to now call the regular board order to meeting called at 6 p.m. Roll call, Jim Anderson.
Present.
Dr. Falvo Lang.
Here.
Roger Giants.
Here.
Bree Higgy.
Here.
Carmelita Smith.
Here.
Cindy Smith, or Sutter, Cindy Sutter, sorry about that.
Here.
Dan Sutter is here. All right, thank you. All right, going to in memoriam, we extend our sincere condolences to the families of the following people who have passed away since our last meeting. Brett Allen Terhune. Brett, age 60, passed away on Sunday, March 29th. He received services from the SSA department and previously attended the Stark County Board of DD workshop. Nancy Doreen Wilhelm, Nancy, age 58, passed away Thursday, April 2nd. She received services from the SSA department for 35 years. And Ryan Adam Clark, Ryan, age 25, passed away Tuesday, April 7th. He received services from the SSA department. And Betty Ann Simon, Betty, age 69, passed away Wednesday, April 8th. She received services from the SSA department and attended Sifrin's The Bridge. So with that, I'd like to have a moment of silence in their memory. Okay, thank you. All right, I now need a motion to approve the minutes from the regular board meeting held March 31st.
Giants moves.
Higgy seconds.
Anderson seconds.
All right. Any additions, revisions, or corrections? Not hearing any. Then all in favor of approval of the board meeting minutes, say aye.
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 Opposed, say nay. No abstentions. The minutes are approved. So we at this time entertain public speaks. I don't know if there's anyone there for public speaks.
There is not.
Okay. So we can move on to the president's report. And first, I need to apologize because I think my mic in my laptop is a little faulty, so it might sound like it's crackly. But I'll try to get that rectified for the future. But in the meantime, I apologize for that. So good evening, everyone. So was pleased to see the settlement with Ball versus DeWine occurring over the weekend. There will be 700 waivers that will be state funded and dispersed throughout the counties, as well as $24 million for capital housing development. So this is a big deal because we expect to see declining state revenues and tax receipts, and preliminary planning from the governor for his departments are to plan for a 15 to 20% decrease. Also saddened by the death of 3 people in our county that we serve, contracting and passing from the COVID-19 virus. At the same time, we're relieved that more people we serve have not experienced the worst of the symptoms, that we know that in no way we're out of the woods yet, and we hope that we can ensure everyone's safety as Ohio's economy opens back up. So with that, I conclude the president's report.
As far as the superintendent's report, just want to provide a few updates since our last meeting. The good news is that the sheltering in place with our providers and families, I mean, we have only had 3 COVID positive people, so that is very, very, very positive. And as Dan alluded to, we were clearly not out of the woods yet, and this thing will be here with us for some time. We are working on a reopening of the board offices, and we are going to just be very slow and methodical with that, because the work that people were doing tele-wise is being effective. So we're just going to be slow. We're going to take our time. We have 4 of our management team members working on that. That's led by Connie Polk. Kristen Quici is on the committee, as well as Amy Anderson and Tim Beard. So we're going to follow all the guidelines that have been recommended, but we're going to just take it slow, and we're going to be steady. And so we'll be sharing that plan with you likely next month. We continue to reach out to family members and people we serve through our SSAs, through our EI department for our 0 to 3, our preschoolers that we serve. We're reaching out to them through teachers and assistants. Through our school age program, our teachers and therapists are reaching out to our students. And then our SSAs are reaching out to all the other people that we are serving. So trying to make sure everyone's needs are getting addressed. And if you could see this room, there's probably about 50 boxes of groceries that we regularly distribute. So thankfully it's slowed down a little bit, but we, well over 125 trips we've made to families and people served to make sure that they just have adequate food. So we continue to work with our providers to make sure that they are well staffed and that their staff members can get some break. There's a lot of overtime going on with our providers. We do have between 15 and 18 of our staff working in provider homes, in family homes, to provide respite. So that it continues to go very well. And we are getting increasing numbers of requests from providers to give their staff a break. So we regularly working with them in that manner. So we've very much been intentional in our responses and reaching out to families and then having them have a mechanism to reach us as well. So we certainly hope no one is falling through the cracks. We are working diligently by calling, recalling, sending text messages and phone calls to families to make sure that we hear back from them to see if they have any needs. You will see a resolution later in the meeting that we have revised. I did reference it in the weekly update, but the reason for the revision was the concern that how it was written could be considered that we were supplementing Medicaid, which we are clearly prohibited to do. So we are trying to find other lawful ways that we can support providers financially at this time, because they are paying increased overtime costs, and that is causing some to struggle financially. So it is interesting. We as a management team, we meet every day, and the last couple have been we're almost to a new normal in regards to those meetings, which is clearly abnormal, but it is normal for the state we are in. So it is great to see. It is comforting to be a part of those meetings every day and hear from early intervention, preschool, school age, our nursing services, our SSAs, our building and grounds, and hearing how we're working together to make sure that we are fulfilling our mission during this very strange and challenging time for so many. So it is a very heartwarming every day to hear the reports. Hey, family needed this, and we got it to them within 2 hours. Family needed this, we sent staff in 4 hours. And I mean, so those stories that happen every day has united us when we've never been more separate. So we're on screens like you're seeing today, and it is really the tie that is binding us is that mission and making sure people's needs are getting met. And it has also been amazing in regards to families' resilience, our provider community resilience, our staff's resilience in trying to make sure that everyone's healthy and safe. So that is what I wanted to share with you today as a part of the superintendent's report, and really just emphasize that our staff is good. Provider staff has been good. Families are working and struggling through this, especially families that have children with multiple needs, and their receptiveness to help with some particular families that would never request help before. We're seeing that. So through this crisis, it's just been really nice to see. And I know it's very, that we're all in this together, that hashtag for Ohio, but we've seen it, and we believe we've been a part of it. And I just wanted to share that this evening. So, any questions? It was very general superintendent report today.
I don't know, Bill, I'm really proud of how the board's responding to this pandemic. These are just really tough times, and it just looks like we're really pulling through very well.
Yes, and we've even had the Ohio Department of Developmental Disabilities. They had a youth in crisis in a small county on the other side of the state. Hey, would you serve this youth? He's like 11 or 12 years old and just really unstable psychiatrically, very challenging behaviorally. And it's nice that they look and will lean in on us from Columbus to this small county in northeastern Ohio. So yeah, that is affirming to us as well as an organization. So that concludes the superintendent's report today.
Okay, thank you. So move on to committee and department reports that are in our board packets. Are there any additions or deletions that need to be made at this time? With none, we're not hearing anything. We do not have any old business or new business. So we'll move at this time to review a policy slated for first reading, and Connie Polton can present.
Connie, you're muted. Nope. There we go.
Okay. Policy 2.16, Administrative Resolution of Complaints, was reviewed with no revisions. Policy 4.14, Layoff of Management Employees, was also reviewed with no revisions. And policy 4.19, Use of Social Media, just a minor update to add that providers are included when we use social media, and that Instagram is another type of social media the board utilizes. That was it.
Okay, thank you. Now we'll move on to the resolutions. Our first one being Resolution 04-1820, approving board expenditures for March 2020. I need a motion.
Giants moves.
Higgy seconds.
Discussion. Any discussion from Lee?
Okay, my button keeps muting and unmuting, so I'll keep an eye on it. Sorry about that. I don't know what's going on. Okay. So month of March, our total local revenues brought in were 93,000. Total state revenues of 233,000. Total federal revenues of 3.6 million. We did receive a waiver settlement reconciliation during the month, as well as the additional state allocation to pay for the HPC increase. Looking just very briefly at our year-to-date revenue as compared to this time last year, in a better position due to receiving settlements quicker due to the additional state allocation, as well as increased targeted case management billing. Looking down below our expenses, total wages, we had 2 payrolls during the month of 1.2 million. Total benefits paid of 667,000 and total other of 266,000 for total expenses of 2.17 million. So with the revenue exceeding expenses by 1.7 million, we ended with the month positively. But if you look at our year to date, we're currently in negative 6.7 million of expenditures over revenues. Just real briefly, looking at the year-to-date expenditures, just some things to note. We will continue seeing an increase in our waiver match. And then, of course, we had some projects. Looking down in the other expenditures, we had some projects done in 2019 that were not done in 2020. So we'll continue to see that variance under capital, probably for the remainder of the year. Down below, we started unencumbered cash at the beginning of January of $49.4 million. We currently have $10.9 million in 2020 purchase orders open. We have closed 270 2019 purchase orders. And with our negative change in financial position, we end the month with $32.05 million in unencumbered cash at the end of March. Looking at our budget versus actual statement, just mainly focusing on our year-to-dates, our target for the end of March is 25%. So you'll see we have brought in 10.27% of the total 50.79 million we expect to receive this year. And our expenditures of 23.5% have expended so far of the expected $50.8 million. Over on the far right, we still have an available budget, which is mostly payroll expenditures of 27.99 million. Next is the prior year encumbrance report of activities. We carried over $736,000 in 19 purchase orders. We have paid $168,000. We have closed $336,000. So what remains is about $230,000, which is mostly made up of the contract floor project purchase order we opened at the end of December. Now looking at resolution 04-1820, you can see our 2 payrolls there. We did pay out $14,000 in stipends in that first payroll. And then of course, each week ending the non-payroll expenses down below totaling $933,000. If there's no questions, requesting approval.
Okay, thank you, Lee. All in favor of the resolution, say aye.
Aye.
Opposed, say nay. Any abstentions? None being, financials for March are approved. Resolution 04-1920. Need a motion to accept the furniture bids for the Whippledale renovation.
Anderson motions. Seconds.
Any discussion from Tim Bird?
Good evening, everybody. This resolution is authorizing us to proceed with the purchase of the newly built early intervention offices on the Whippledale contract floor. We previously had a not to exceed of $70,000 resolution. We had 4 furniture companies actually bid on the project. with Temple Square being the lowest bid at $66,925.32. This will provide us with 26 workstations with task chairs, etc., that will get them up and running with a delivery sometime the end of June, early July. Questions?
Any questions from Tim? All in favor of the resolution 0419, say aye. Aye.
Aye. Aye.
Opposed, say nay. No abstentions. The resolution is approved. Resolution 04-2020, need a motion to approve an emergency leave policy pertaining to COVID-19.
Higgy moves.
Second,
Calvin Lang, second.
and discussion from Connie.
Resolution 04-2020 is in accordance with policy 1.08, which states that the board has the authority to waive the first reading of a policy by an affirmative vote of not less than 5 members. The emergency COVID-19 leave policy is also included with this resolution and outlines the criteria and the guidelines of the Families First Coronavirus Response Act. And this policy provides employees with direction on how to utilize the assistance of the Response Act. This policy will be in place until December 31st, 2020, and consists of 2 key components. Those components are the 2 weeks of paid and expanded FMLA for employees who meet the criteria pertaining to the COVID-19 pandemic. And again, all of this information is provided in the policy.
Any questions for Connie on the resolution? With none, all in favor of the resolution for 2020, say aye.
Aye.
Aye. Say nay. No abstentions. The resolution is approved. Then we've got resolution 04-2120 is approved financial assistance for HBC provider community. Need a motion to approve? Or-
Higgy moves.
Giant seconds.
All right, and discussion from Lee.
Thank you. Resolution 04-2120 is to approve to provide financial assistance in accordance with the listed revised and administrative codes to the provider community during the COVID-19 crisis at an amount not to exceed $175,000. The board has taken several actions to support the provider community during the stay-at-home order, which includes the leasing of our staff, providing technical assistance, purchasing supplies, and making PPE available. To complement these efforts, the board intends to provide financial assistance on a reimbursement basis to assist providers with the purchase of household supplies, groceries, equipment, health and safety supplies, and to provide additional funds for room and board as needed. To receive the reimbursement, providers will be required to enter into an agreement with us and to provide receipts and a copy of their expense ledger to prove purchase for reimbursement of the item. We are allowing expenditures back to the issuance of the stay-at-home order, which was on March 22nd, 2020. All payments also are temporary and subject to budget availability, and the amounts can range between as low as $200 up to $10,000. And we will be basing it on the number of clients that those providers serve when we determine amounts that they can be reimbursed for. Any questions?
A big need for that.
Say that again.
How much of that do you anticipate? I mean, are providers calling and needing a lot of extra stuff?
We currently, I believe we have about 16 applications, and the deadline is tomorrow. So we thought we would have received more, but currently, right now, we just have 16 providers that apparently there is a need for them to be reimbursed for those expenses.
Okay.
So in regards to need, it is really in regards to their overall financial operation, because they're paying overtime and the rate isn't covering the amount of overtime. They are losing money. And so this resolution proposes some relief with their rent, relief with their utilities, I think is covered, correct me if I'm wrong, Lee. And as well as groceries that they're purchasing. So it's to
Kind of
supplant,
to offset what they're losing
yes,
for over.
exactly.
Okay.
Okay, any other questions for Lee? With that, all in favor of the resolution, say aye.
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 Opposed, say nay. No abstentions. The resolution is approved. Now we move on to second reading of board policies that were presented in the March board meeting and discussion from Connie.
Policy 1.03, meetings of the board. Policy 4.50, cell phones. 4.58, fitness for duty, and policy 5.26, school age excess costs were all reviewed, and there were no changes recommended.
Okay, thank you. That brings us to resolution 042220, provides approval for the board policies presented for second reading. I need a motion to approve.
Anderson motions.
Is there a second in there too?
Approve.
Okay, is there any other discussion? I don't think there's any there. All in favor of the resolution for second reading, say aye. Aye.
Aye.
Aye.
Opposed, say nay.
Aye.
No abstentions. The board policies are approved. So now I need a motion to adjourn.
Gines moves.
Peggy seconds.
Anderson seconds.
Okay, all in favor, say aye.
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 Opposed, say nay. No abstentions. We are now adjourned at 6:28.
Thank you, everyone.
Thank
Thank
you.
you, everyone.
You.
You.
Stay safe.
Everyone has a good
Everybody.
rest of the day.
Yep.
Bye.
Bye.
Say, yeah.
Have a good evening.
Participant
Say
has
thanks
left
to
the
your
meeting.
team.
I will.
Thank you.
I know that I'm in the witness protection program now. Look at it.